Pneumonia is a respiratory condition characterized by inflammation of the lungs, primarily affecting the small air sacs known as alveoli, while walking pneumonia, a milder form, is caused by specific bacteria and presents with less severe symptoms. Typical symptoms of pneumonia include a deep cough with phlegm, fever, chills, and difficulty breathing, which can range from mild to life-threatening, whereas walking pneumonia symptoms are often similar to those of a cold, such as a dry cough, low-grade fever, and fatigue, often leading people to underestimate the illness. Walking pneumonia allows individuals to continue their daily activities, hence the term walking, but it can still have a prolonged recovery period without proper care. Treatment for both conditions often involves antibiotics, rest, and fluids, but severe cases of pneumonia may require hospitalization and more aggressive interventions. Risk factors such as smoking, a compromised immune system, and chronic lung diseases can increase the susceptibility to developing either form of pneumonia. Understanding the detailed aspects of these diseases, such as their pathogenesis, diagnostic methods, and preventive measures, is key to effectively managing and overcoming them. Affected systems: lower respiratory tract versus upper and lower respiratory tract. Pneumonia typically refers to an infection of the alveoli and can be quite severe, manifesting with high fever, productive cough, and marked lethargy. It often requires aggressive treatment, including antibiotics and hospitalization. In contrast, walking pneumonia, usually caused by Mycoplasma pneumoniae, presents with milder symptoms that might resemble a common cold, as it can involve both upper and lower respiratory tracts. Patients with walking pneumonia may experience a persistent dry cough, low-grade fever, and fatigue, but can often maintain their daily activities. Recognizing the distinction is vital to ensure appropriate treatment and prevent complications, especially for at-risk populations. Nature of onset: acute versus acute or chronic. Pneumonia and walking pneumonia are often confused due to their symptomatic similarities, but key distinctions in their onset help differentiate the two. Traditional pneumonia effectively announces its presence through acute, often severe symptoms such as high fever, chest pain, and productive cough. Its onset is clear-cut and often demands immediate medical attention. In contrast, walking pneumonia, caused by bacteria like Mycoplasma pneumoniae, may exhibit a more insidious onset. Patients can experience milder, yet prolonged symptoms such as a low-grade fever and a dry cough, sometimes developing over weeks. This chronicity can lead to delays in seeking treatment, as symptoms can be mistakenly attributed to a common cold or fatigue. Identifying these nuances is crucial in administering appropriate care and avoiding complications that stem from delayed intervention. Common symptoms: consolidation versus inflammation. Pneumonia and walking pneumonia represent 2 points on the spectrum of lung infections. Classic pneumonia typically presents with consolidation, a term describing the filling of the air spaces with fluid and cellular debris, leading to severe symptoms like productive cough, fever, chills, and difficulty breathing. This condition can be visualized on a chest X-ray as dense areas. Walking pneumonia, caused by bacteria such as Mycoplasma pneumoniae, generally causes milder inflammation in the lungs without the significant consolidation seen in typical pneumonia. Symptoms might include a dry cough, low-grade fever, and fatigue, and affected individuals can often continue with their daily activities, hence the term walking. The distinction between the two is crucial as it influences treatment choice, the need for hospitalization, and the approach to care and recovery. Radiological findings: infiltrates versus no infiltrates. Typically, conventional pneumonia presents with well-defined infiltrates visible on a chest X-ray, indicating an acute infection in the lungs' air sacs that could manifest as localized lobar consolidation. This is a hallmark of the disease's severity, necessitating an aggressive treatment approach. On the flip side, walking pneumonia, often caused by Mycoplasma pneumoniae, is milder. Patients might not look very ill and are sometimes referred to as having atypical pneumonia. Radiological findings are less pronounced. Chest X-rays may reveal patchy infiltrates or sometimes appear deceptively normal despite clinical symptoms, hinting at a less aggressive infection that often requires a treatment approach aligned with its milder nature. Typical etiology: bacterial, viral, or fungal versus viral or bacterial. Pneumonia and walking pneumonia are both respiratory conditions, but they differ in severity and causative agents. Traditional pneumonia can be caused by bacteria, viruses, or fungi, often leading to severe symptoms that require bed rest and can result in hospital admission. Streptococcus pneumoniae bacteria is a common culprit. In contrast, walking pneumonia, often caused by Mycoplasma pneumoniae bacteria, presents with milder symptoms, and those affected can generally continue with daily activities. On occasion, viruses may also be responsible for walking pneumonia. Both forms are infectious and can spread via respiratory droplets, but the severity and treatment approach vary, with walking pneumonia typically resolved with less aggressive treatment.